5 essential checks before you submit your DClin application. Welcome back everyone, my name is Sam. I'm a trainee clinical psychologist who is about to graduate in a few weeks' time. If you're preparing to apply for the Doctorate in Clinical Psychology in the UK, you know how competitive that is. So in today's video, I want to walk you through 5 checks to do that I think are important before you hit submit on your application. These tips will hopefully help you stand out, not by having the most ridiculous personal statement, but by showing the examiners that you know what a trainee clinical psychologist requires, and it shows them who you are as a clinician and who you want to be. So first, let's talk about the skills that you want to show in your application. You know, the courses aren't just looking for academic ability, they're looking for a well-rounded clinician. So that means showing things like having resilience, which is, the ability to cope and grow from challenges, having reflexivity, so being able to think about your practice and learn from it, having time management. The DClin course is a pretty intense training. You have to juggle between placement, lectures, supervision, your thesis, exams, and courseworks. So examiners would be looking at whether or not you have the skill to balance competing demands, and of course whether or not you have compassion, which underpins everything that we do. In terms of clinical skills, examiners may be looking for your ability to show formulation-driven thinking. So the difference between being a trainee clinical psychologist than, let's say, a CBT therapist or a psychotherapist is our ability to draw from different psychological models. So in your application, if you have experience of, for example, using CBT, but then also systemic psychodynamic psychotherapy, I think it'll stand out for you if you are able to reflect on using different models for a formulation-driven piece of work. Another clinical skill that's important is being able to work with complexity. In training, you're going to be working with patients that often have a very complex presentation, and because real-life clients don't usually fit into boxes and manuals. So I think being able to show that you have the experience of working with complexity will benefit your application. And if you have any experience working with teams, MDT teams in particular, I think it'll be good to show examiners that you have the experience and that the skills required to work with MDT teams. So you can touch on being able to work collaboratively with psychology and non-psychology professionals, being able to communicate complex theories, being able to work collaboratively. Another skill that's important is to be able to demonstrate a scientist practitioner mindset. And what this means is that, we're training to become clinical psychologists, but this is also a doctorate. And so we learn to become both a scientist and a practitioner. So for example, as psychologists, we may oftentimes need to refer back to literature in order to drive our practice. So that's what it means to be a scientist practitioner. But we are also scientists as well. So what that means is using our clinical experience and clinical training, we are able to use our practice to drive research. And we call this practice-based evidence. So there's evidence-based practice, which is important and a lot of people cover, but also practice-based evidence, which a lot of people sometimes miss. And I think it's important to highlight that, in the end, we will be scientists. So I think it would be good to include that in your application. I think using supervision is also important to highlight. Whether or not you are supervised by your research supervisor or a clinical psychologist having clinical supervision, I think it's important to include that in your application. And the main reason why it's important is because as trainees, we'll be supervised weekly by a clinician. And so it'll be important to showcase that you understand the importance of clinical supervision, because it'll be unethical to practice as a psychologist, whether or not you're as a trainee or as a qualified psychologist, without adequate supervision. So being able to use the supervision space effectively will be important as a trainee, but also as a qualified clinician. So this is something to think about. How can you use supervision effectively, which I could make another video about in the future. The second important point to think about is, how do you stand out? It's not about who has the most years of experience, who has the most variety of experience, but what you have taken away from your own personal experiences as an assistant psychologist, or as a research assistant, or as a PWP, for example. So instead of saying I've worked in a number of services across X amount of years, it's about, through this personal experience I've had in this role, I've developed XYZ. So for example, let's say if you have worked in forensics, you could say, through working in forensics, I've understood the importance of unconditional positive regard and how this has impacted my future work when working with patients who may be a bit more difficult or a bit more challenging, especially when their beliefs will not align with your values. So this is something that is very personal, which is important in your application, but also something that shows that you are able to reflect and you are able to put your own personal experience into the application, which I think are ultimately the most important thing. This leads me on to the third checklist, which is the question on whether or not you have shown your personality across. Remember, this isn't a robot competition, right? The interviewers or the examiners want to get a sense of who you are as a person, as a future colleague, and as a future psychologist. So every clinical psychologist is different. So ask yourself this question, does your application sound like you? Does it show who you want to be as a clinical psychologist? Or could it have been written by ChatGPT? So don't be afraid to let your voice come through in a professional but personal way. I always like to include a little bit of humor in my applications, or something that shows my excitement wherever relevant. So for example, writing an application for a CAMS job, for example, I want to showcase my excitement when I work in play therapy, because I am truly excited working in a very playful way in the therapeutic space with children. So that is something that to think about for your application. How can you showcase your own personality and the clinical psychologist you want to be in your application. The fourth checklist is the research and dissemination part. The DClinPsy is rooted in the scientist practitioner model. For your application to the DClinPsy, you don't need 3 masters, you don't need 10 publications, you don't need a PhD. Really, all you really need is an undergraduate knowledge in research methods and statistics. You need to show the examiner that you have a solid grasp of undergraduate level research methods and that you can communicate findings clearly. So for example, even in your undergraduate, you have written a dissertation. What skills have you learned while writing that dissertation? You've probably presented in a conference or made a poster about it. What skills does that require? Designing a poster and communicating to a variety of audiences. Maybe in your research, maybe in your job, you have supported in doing an audit or service evaluation. How might you highlight how you disseminated that knowledge? And finally, there is one more section on the application called the Others section. Please don't ignore the Other section on the application form. I think the entire form just doesn't have enough characters for us to describe all the experiences that we've had and all our personal journey that we've gone through. So please use the Other section of the form to write things that are relevant to yourself and relevant to your professional journey. So for example, this section can include things like your volunteer work, creative projects that you have done, podcasts, blogs, advocacy work, anything that shows you as a whole person that could also be relevant in clinical psychology. Sometimes this section is what helps your application really stick in the mind of the examiners, so hopefully you can make good use of it. So 5 areas. First, have you demonstrated key skills in your application? Have you shown reflection, not just a list of experience? Have you let your personality come through? Have you highlighted your ability to disseminate research? And have you used the other section to round out your application? Again, I could go on for a whole hour about fine-tuning your DClin application before you submit. So hopefully this quick tour is helpful in any way whatsoever. And if you have any questions, please feel free to write it in the comment section and I'll try my best to answer them for you. Good luck on your DClin's application. It is super competitive. Please pat yourself in the back. I know just writing it out, even the first draft, is probably very anxiety provoking, very strange having to sell yourself. So good luck.